Peripheral vascular disease, also known as peripheral artery disease, is a disease affecting the blood vessels, primarily of the legs and feet. It is associated with narrowing of the arteries, decreasing blood flow to the tissues, and when left untreated, cause tissue damage.
The most common affected population is those over 50 years old. Men are slightly more likely to develop it. Also contributing are high blood pressure, high cholesterol, diabetes, smoking, and being overweight. If there is a family history or a history of heart attack or stroke, there is also an elevated risk.
In the beginning of the disease, upon inspection, you may see hair loss and on palpation. The skin of the affected limb will be cool to touch and have weak or absent pulses. If you auscultate, there will be decreased blood pressure in the affected limb, and you may also hear arterial bruit. As the disease progresses, the calf muscles may shrink. There are painful sores on the feet that don't bleed and are slow to heal. The color of the skin becomes blue due to lack of oxygen. The skin also becomes tight and the toenails thicken.
This disease is caused by hardening of the arteries as a result of high cholesterol or chronic high blood sugar as a result of diabetes. It may also be caused by a blood clot, infection like syphilis or salmonellosis, inflammation, genetic abnormalities of structure, or injury. Symptoms of PVD develop as blood flow to the affected limb is reduced.
Insulin resistance contribute to endothelial dysfunction by decreasing nitric oxide bioavailability and altering the function of various cell mediators. Oxidative stress subsequently promotes the formation of foam cells and fatty streaks. In addition, vascular smooth muscle cells exhibit enhanced migration to newly formed lesions, further augmenting plaque development. In advanced atherosclerosis, patients with diabetes have less smooth muscle in the lesions and are more susceptible to plaque rupture compared with the early stages of atherosclerosis. Furthermore, increased platelet aggregation and impaired fibrinolysis also increase the risk of thrombosis, leaving the patient at high risk for complications. Failure to identify and prevent PAD at an early stage can ultimately result in symptoms of intermittent claudication, critical limb ischemia, and lower extremity amputation.
I like to walk. I had my walk every day. And the first thing I would notice is on my walks, my calf would have a very sharp pain. If I stopped, it would go away, and I'd continue. And I did that for quite a while, and I said, gee, this is strange. I had an appointment with my regular doctor, and that day, for some reason or other, I had to go up the stairs. And going up the stairs was, I thought I was going to pass out. It was just so, the pain was just so bad. And I told my doctor about it. Well, the minute I told him, he took off my shoe and was trying to feel the pulse. And this is how it all started.
As the nurse caring for this patient, you should advise them to stop smoking, change their diet, including more fruits and vegetables, explaining that these changes may help lower cholesterol and blood pressure. They should be advised to lose weight and get regular exercise as the disease allows. Finally, they should be treated for the sores on their feet, and the nurse should teach the patient proper foot care.